Hi everyone and welcome to Easy Learning. So we are covering the ABAT competency standard, and in the first part we learned about ASD and common characteristics and deficits. Today we will be covering the second part of autism core knowledge, and it is about autism as a spectrum disorder and its core deficits as outlined in the DSM-5. So let's get started. We have already studied why we refer autism as a spectrum disorder because the symptoms varies in individuals and also the severity of it varies from mild to severe level. That's why autism is referred to as a spectrum disorder. Now coming towards the core deficits of autism spectrum disorder as outlined by DSM-5 are: the very first is deficits in social communication and social interaction. And the second one is restricted, repetitive patterns of behavior, interest, or activities. So basically, there are two main domains in which we talk about the core deficits for autism. For social communication and social interaction, the difficulties are with social reciprocity. Reciprocity is when you respond to someone. You're basically reciprocating the communication, and for individuals with autism, they face difficulty in responding to others in communications or conversations. They also face difficulty with non-verbal communication. Non-verbal communications mainly include facial expressions or gestures. So the individuals with ASD may face trouble interpreting the facial expressions or gestures of next person, or may have difficulty in expressing with their own expressions or gestures. They also have difficulty in developing, maintaining, and understanding relationships. It's hard for them to understand the roles of relations, and this is all about the deficits in social communication and social interaction. Coming towards the next deficit, which is restricted repetitive patterns of behavior, interest, or activities. So basically, the motor movements in them are stereotyped or repetitive. It could also be about use of objects or their speech, which means they might be repeating different words, they might be repeating certain movements, for example, to and fro movement of shoulders, or rotating hands or head again and again, and also using single or similar objects continuously. The individuals with ASD insist on sameness, inflexible adherence to routines or ritualized behavior. So basically, the individuals with ASD, they like to adhere to their routines and they are inflexible in their routines. So it's hard for them to adapt to changes. Their interests are highly restricted and are abnormal in intensity or focus, like it could be either too much or too less. So the intensity also varies. And then they have hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. Okay, so coming towards the MCQ part, all you have to do is to read the MCQ, pause the video, answer by yourself, and then resume the video to see if your answer is correct or not. Don't forget to share your score in comments. The first one is, what is a key difficulty associated with social communication deficits? The answer is difficulty with non-verbal communication. Which of the following behaviors is indicative of restricted, repetitive patterns of behavior? The answer is stereotyped motor movements. What type of interest is commonly observed in individuals with social interaction deficits? The answer is highly restricted and fixated interest. What describes the insistence on sameness in behavior? The answer is inflexible adherence to routines. Last, hyperreactivity to sensory input may manifest as overwhelming responses to sounds or lights. Did you score all 5 or missed any? Share your scores in comments. If you have any questions, you can ask also. Thank you for watching.